Excellent. Yes, positive and negative feedback. Very glad you brought those up. The body doesn't just stay static. Our blood pressure doesn't just stay at 130 over 90, right? It's always moving, it's always shifting, but positive and negative feedback help to encourage it to move in one direction or the other. Um, this is also going to include things like sensors and detectors that are continually measuring these variables, and then they can be corrected using positive and negative feedback loops. Okay, perfect. So this is basically how our body can maintain a relatively constant internal environment when it comes to our temperature, our blood volume, our blood composition, the pH of our blood. All of those are maintained within a relatively small window or constant environment, even though we're in the face of change. If you go to a very cold climate, your body temperature tries to stay within a certain constant environment. If you go to a really hot climate or hot area, your body temperature is also still going to try to stay within that range. So the way that it does that is through organ systems integration. And if we disrupt this mechanism, if we disrupt the ability of the body to stay within its relatively constant internal environment, this is the beginning of disease. This is the beginning of pathology. This is the beginning of the sequence of events that will eventually lead to death. So this is what I mean by saying that homeostasis is important for our survival. Keeping the blood temperature is important. Keeping our blood pressure is important. If blood pressure gets too high, we're going to have kidney failure, we're going to have heart failure, we're going to lead down that path to death. If our blood pressure gets too low, we're going to lose the ability to perfuse organs adequately, and again, we're going to lead to disease. So neither too much or too little is right, is acceptable. Having that perfect, relatively constant internal environment is the goal, and that's what homeostasis helps to maintain. All right, this little image here is kind of a way to represent that or illustrate that. So on the left, we have a scenario where this rock is in place. It is in the optimal condition or the optimal state, we want to say. And then far on the right is when it is in what we would compare this to as disease, right? That's going to be alternate to its optimal state. Now, in the middle is the best way to describe homeostasis. It's neither perfect nor is it flawed, but it is the striving to maintain perfection. It is the correction of any type of disease or any type of straying from the normal internal environment. So this is what homeostasis is. It's not when things are perfect, but it is the attempt of the body to bring these variables back to their perfection, right? Back to their optimal state. All right. Let's look at an example and introduce some terms that are vital to bringing about homeostasis. So regulated variables are the aspect with which we want to maintain a certain number. Some of the examples of regulated variables can be blood pressure, they can be blood pH, I think we said body temperature. Can anyone think of any others? What are some other variables that we might want to maintain in the body? Any other variables that come to mind? So blood sugar is another good one. Blood sugar is a variable that we want to keep within a certain range. This is why after we have a meal, your body releases hormones to sort of distribute that sugar and to prevent it from building up in the blood. And if we haven't eaten, the opposite happens. The body tries to tap into its fat stores to help increase the glucose in the blood. So this is another variable that we want to keep within a certain set point to maintain our optimal functioning in the body. Set point. So set point is the second term here. It is the expected value of the regulated variable. An example of a set point would be 120/80. That's kind of where we like to see blood pressure. 120/80 to maybe 130/90 if you're in the older range. But this is the value that we, the body really would like to see that variable maintain at, okay? If we look at this example here, we can think about describing these terms a little bit more. So our set point is 60 miles per hour, and that is the speed with which the car is going. And so let's say we're driving along a hill or driving along a road that's kind of elevated, and we dial in our set point and we put on our cruise control and we ask the car to maintain this value. So we're going to start at 60 miles per hour. We're going to elevate up at the foot of the hill. And because of the rise of the elevation here, the speed is going to decrease. It's going to drop to about 55 miles per hour. When it does that, that's going to send off an error signal. The error signal is telling us our set point has strayed away or veered away from what we would like it to be, and our regulated variable needs to be corrected. Okay, so 55 miles per hour is lower than what our set point was, and so we're going to send off an error signal in order to help increase that back to the set point value. What that will do is it's going to increase gas flow to the engine of the car. That's going to help increase the speed of the car. And as we can see, that's going to help to correct the set point and bring it back to the desired value. So it's going to bring it back to 60 miles per hour as we continue to elevate up the hill. Okay, and then when we get to the top here, we're going to be back at our set point, back at 60 miles per hour, and then we can go ahead and turn off that error signal. All right, so this is a good example of what happens inside our body to maintain the set point value of all of the regulated variables, all the examples that we gave. So if you look at that more in terms of a graphical representation at the bottom here, we start off at 60. We somehow veer away from that desired value. The degree with which we have veered away from the set point is the degree of the error signal. So if we have gone way below our set point, we're going to have a bigger error signal. If we've just gone a little bit below our set point, we're going to have a smaller error signal. Okay, this is why when your blood sugar is really low, you're going to faint, right? Your brain is going to stop sending signals. You're going to lose consciousness and you're going to faint because that's going to be a bigger signal because you're now further away from that desired value. And then when we get back to that corrected value, we can turn off the error signal entirely. Okay. Now, to get into some more of the mechanism of how this is brought about, there are some other terms we want to introduce here. So negative feedback. If a regulated variable decreases, the system is going to respond to make it increase, and the opposite is true as well. If the variable increases, the system is going to respond to make it decrease. In other words, this is a self-correcting signal. I don't have to be consciously thinking about my blood pressure in order to detect and correct it. This is happening all in its own. This is where negative feedback will come into play. And then just to further describing the error signal, it's the difference between the set point value and the value that we're currently at. And as a result, the degree of that difference will determine the degree of the error signal. Okay, now what I want you guys to do, this is an example with blood sugar. I'm not going to go through the exact example, but I want you to practice this as take-home work. So when we meet next time we meet, we're going to actually draw out the example, but I want you guys to take an opportunity to practice that. So think about an example of blood sugar and using this as a template, right? This example here, try to illustrate how we can have a set point with blood pressure, how we can have an error signal with blood pressure, and how we can have a negative feedback response without blood sugar as well. Okay, so use this example of a variable and practice illustrating what that loop or that feedback response would look like. And then we'll discuss next time we meet. Okay. All right. So let's talk about the loop that's happening here and how these other players come into play. So the structures that are helping to enable homeostasis are receptors, integrating centers, effectors, and then signals. So the receptors are going to be the sensors in our body that will detect a certain change, okay? Whether it be receptors in your body or whether it be receptors in your brain, they will be able to detect any change to the variable that we are trying to measure or monitor. Integrating centers are usually the brain. And when we talk about the brain, specifically the medulla oblongata of the brain, this is where that information goes to. So receptors pick up information, they send that up into the brain, the medulla oblongata. The brain will make a decision, not a conscious decision, because I'm not thinking about this. But the brain, the medulla, which is the unconscious part of the brain, will make a decision as to whether or not that variable is in its correct parameter. The measurement that was appreciated from the receptors is going to be sort of analyzed in the integrating center, and it's going to determine whether or not it is appropriate. The effectors are going to be the organs that bring about a change or the organs that bring about a response. Okay, so in this example, that would be the heart. So because blood pressure dropped, that was the signal detected by receptors, right? That was picked up by the receptors that monitor blood pressure. That was sent via sensory signals using our neurons and our nerves to the brain. And then because this was low, right, if we lie down and raise really quickly to a standing position, it's going to think that the blood pressure is low, and then it's going to send a signal to the heart to increase the flow of blood to help increase or correct that drop in blood pressure. And then this would be a negative feedback response by correcting the initial drop in blood pressure, okay? So this is how we can think about receptors detecting the change, integrating sensors, measuring or analyzing the change, and deciding to make a corrective response. And then the effectors actually bringing about that corrective response. Okay, the signals would be the messages that are sent using neurons. So the signals being detected from the receptors that go to the brain, and the signals being detected from the brain that go to the effector organs. Those can all be considered as signals. And then the negative feedback response is the corrective action. It's the rise in blood pressure that will correct the initial drop in blood pressure. Okay. So just to talk about some examples of each of those components, receptors or sensors detect the stimuli. These can be thermoreceptors that detect changes in temperature. We have those on our skin. We have those in our blood vessels. These can be chemoreceptors that detect changes chemically. So to detect the amount of oxygen or CO2, detect how much of a certain chemical is present or absent. Or they can be baroreceptors, and baroreceptors detect changes in pressure. So how much force is blood moving through the vessels with? That would help detect whether blood pressure is high or blood pressure is low by monitoring the changes in mechanical pressure. Integrating centers, these help to orchestrate the appropriate response. They're kind of like the CEOs. They take the information from the other members of the team. They make sort of an executive decision or executive call, and then they send that decision down to the effector organs to help bring about that change. Okay, as I mentioned before, these are usually in the brain, sometimes in the heart. We'll talk about some examples in the heart later on as well, but usually the medulla oblongata. Signals, so signals can be communication, they can be input going to the brain from the organs or receptors, or they can be output signals going from the integrating centers in the brain to the effector organs to help bring about that change. So we can have a bidirectional flow of these signals, and these are, again, usually going to be neurons that are helping to relay these messages. And then lastly, effectors, these are going to help bring about the response. This can be muscle, whether it be smooth muscle in our blood vessels and our GI tract, or striated muscle that help to move the body, that's our skeletal muscle, or cardiac muscle, which would be the heart. Another example of effectors can be glands. So let's say there's a thirst response that was set off, the brain will detect that change, and then it's going to stimulate, let's say, the salivary glands to help secrete more saliva to help correct that signal and help to bring about that change. So glands can be another example of effector organs as well. Okay, this is just another example of the loop. So sensors detect the change, integrating centers analyze the signals that are being sent and determine the appropriate response to correct the change, send those instructions to the effectors, and the effectors are the ones that actually bring about the change that will correct the initial disturbance to the change or disturbance to the variable. All right. And then just showing that again in a different way at the bottom, we have our change that's detected. Integrating centers help to bring that response about, and then immediately it can be corrected by our effectors. So this is just showing you how this happens with time. So this is going to be an immediate self-correcting system, and it's not going to take days or hours or your conscious thoughts or any actions on your behalf. It's going to happen immediately as soon as those signals are detected and are sent. Okay, we're just almost